Hey folks, Dr. Eric Hughes here. In today's video, we're again going to be revisiting the topic of fascial remodeling. In this particular series or video in the series, we're going to be talking about what does that feel like? What does that look like for a patient, for a client, someone who wants to pursue that for themselves? I am both excited and kind of hesitant to making this video because it is totally different for everybody. Whether um, you have a history of pain or injury or trauma, a mental, emotional, or physical trauma. It's always different for everybody. I'll start off by saying this again. Some of the qualities that we look for in healthy fascia is that it's very pliable, it's very elastic. Everything moves well, everything's fluid and efficient. And see, these are some of the exact things. And I'll do an aside. When I'm talking about fascial remodeling, I'm primarily going to be talking about revolution in motion, which is the movement modality that I implement in my practice with myself. And then I provide this for my patients, and I show them how to do this at home safely and effectively. And so these specific qualities of healthy fascia are exactly what we try to impart in revolution in motion, right? Our movements are fluid and efficient. Our movements are going to be dynamic, where we work with those end ranges of motion in a safe and effective manner. But what we're doing, again, if we take this, my hands are my fascia, right? We talk about loading and rebound, right? This loading is that elasticity through those fascial layers, and the rebound is coming back to that resting state, right? And then we can most effectively get through that through dynamic movements, dynamic cyclical movements. So I'm going to try and refrain from saying this. What this feels like tangibly for a lot of patients is going to be just like the best stretch of your life. Again, we're not stretching because we're not getting out there and just holding it. We want to work through the layers, right? Again, this fascia is, if you have densified fascia or dysfunctional fascia in a certain part of your body, it's going to be stuck, it's going to be gunky, it's going to be adhered, it's going to feel like honey consistency in between those layers. We try and get that elastic, that loading, that rebound, it's going to feel like this, right? We don't get that full range of motion in the rebound. And so what we work towards is how can we slowly start to really unhear the opposite of adhere. I don't think that's a word. We can start to improve the mobility, the elasticity. I'm going to say that word a lot, through those layers. Again, tangibly, some sensations that I notice, that patients notice the first time they do it, is it just feels like, again, like a really satisfying stretch. It's like this really deep itch, and you're just scratching it. You're like, oh my gosh, that sometimes it feels burny, sometimes like a little bit of a burning sensation, sometimes it feels achy. If we're working in areas that have been protected for a long time, subconsciously through posture or areas of injury, right, it might feel a little unsafe at first. It might feel scary, right? If we want to get to the emotional side, right? If we have a lot of low back pain, well, that fascia is adhered around our kidneys, for example, right? Kidneys are the organ that are associated with fear, right? So if we start to mobilize that area, right, we're not going to feel, we're working through a lot of stuff, folks. But at the end of a Rev and Mo session, after your first time or your 50th time, what you're going to notice afterwards is just this sense of being free, right? You're going to, when we talk about revolution in motion essentials, you're going to notice this lift in your chest, right? Your torso is supporting itself. You're going to notice your abs are going to hollow, right? You're going to engage your core in a much different manner. Your low back is just going to open up and relax, right? We're lengthening the spine from our head all the way down to our tailbone. Our feet are going to be engaged, right? All these little things are just going to start to fall into place, right? And as a result, objectively, your posture is also going to improve. How you hold yourself up in space and time is going to improve. Your pain is going to decrease. Your function is going to increase. Your performance, whether that's physically or with your business or with your work, is going to improve, right? Things are just going to flow more freely, more efficiently, more fluidly. you're going to feel better. I mean, what more could you ask from it, right? And not to mention, it is so fun. Again, specifically with Revolution in Motion. So that's kind of a little bit of an insight into what fascial remodeling feels like from a Rev and Mo standpoint. Again, working with that elasticity of the fascia, trying to rebuild healthy connective tissue. As an aside, I feel like I want to mention this before I let you guys go. When we do get, because we're not invincible, right? We're not setting ourselves up to be invincible. Like, things are going to happen. You might get an ache or injury over time, but your ability to bounce back from that injury, from those aches and pains, is going to be substantially decreased, right? Because we already have a healthy environment, a healthy set of connective tissue around muscles, around joints. Your body's going to respond that much faster. And honestly, if we want to talk about aging and just aging in general, if we have healthy connective tissue, our the aging process is going to be that much more graceful, right? This is truly like one of the pinnacles of anti-aging, right? Forget about, I don't want to get into it, but Revmo is great. That's all I got to say. That's the end of this video. And I'll catch you guys next time. Take it easy.